Hello, ladies and gentlemen. My name is Basule Isaac. I just completed my 5 years doing a degree in medicine and surgery at Uganda Christian University School of Medicine, and I await deployment for internship, after which I will obtain accreditation, or after which I will be certified to work as a doctor in any part of the world. Uganda Christian University School of Medicine started in 2018, and I was part of the lot that started the medical school. Today I'll be sharing with you my experience and my journey, what I've encountered through these 5 years. Thank you. So first and foremost, what is medicine and what is surgery? So this is a 5-year-long training for Uganda, where one is equipped with the skills to be a doctor. That is helping people attain better health, both preventively but also therapeutically. Preventively meaning helping people not actually get diseases, but therapeutically meaning when someone has the disease, doctors will help the person recover from the disease. And also, after someone has been treated for the disease, to help them recover or to help them be rehabilitated. So that is what medicine and surgery training is about, and it's 5-year long. What were my expectations coming into medicine and surgery? Right from when I was a little boy, I heard about doctors. At that point, I was mixed. I didn't know precisely which career path I wanted to take. But as I grew older and interacted with different people, I came to the realization that I wanted to be a doctor. I wanted to help people, but I also wanted challenge, because dealing with people is in itself is a challenge. Then also the other expectation I had coming into medicine was the diversity that it comes with. Medicine is a very diverse field, as you know. We have young people, different populations within the whole segment of medicine. We have children, we have women, we have men, we have old people, and all these different populations have different expectations. So the diversity that comes with medicine itself was one of the things that pulled me into the profession. Were my expectations met coming into medicine? First and foremost, coming into medicine, it was what can I say? There's a lot. That I could actually say, but I joined, like I said, I joined UC School of Medicine in 2018, and at that point in time, it was a mixed kind of picture. I was anxious, but at the same time, I was wondering if I would really manage. Being that we were the first lot, starting up anything is never easy. So that anxiety of whether we would graduate, that anxiety of whether we would be the doctors that we actually wanted to be, came in for me. And we didn't have immediate people to look up to at that point in time. So all that came into the picture. But one of the things that I had at the back of my mind was the destination. I never lost sight of where I wanted to be. I never lost sight of the dream that I had carried for a long time. So coming into medical school, I had to sit an interview. That is the practice at Uganda Christian University. An interview is done, an oral and written, and I did that. I excelled at my interviews, and I was admitted for the course. So the first year of school is really about the basic sciences, because if you're going to deal with human beings, then you have to understand the structure of a human. You have to understand how a human being works. So year one is really about understanding the normal functioning of the human body. And being in Uganda Christian University School of Medicine, there is a bit of additional things that we are taught, because our vision is to have a complete education. So they teach us aspects of sociology, how do we relate with people in the community, They teach us a bit of writing and study skills. So it was really a complete regimen, aside from the academic work, aside from the medical menu, we also had more. So year one was a bit of a challenge. But as time went on, I actually realized that these are things that we could understand, that these are things that were not exactly new. We already had some questions. For example, you'd wonder how a human brain works, and then what is located. I mean, what is the structure of the brain? What is the structure of the chest? What is inside this structure of a human being? So those are some of the questions that were answered. And part of what we do in our year one training is we have what we call cadavers. We have what we call cadavers. I don't know if some of you have heard of those. These are like specimens. They're actually people, people, deceased people. So we use those as specimens, to study the structure. And I remember some of our colleagues were scared. Some of them ran out of the labs. Yeah, I was a bit scared myself, I have to admit that. But, eventually you realize that it is part of the process, because my mind was fixated on the destination that I wanted to achieve. And I knew for me to get there, I actually had to do this at whatever cost. So eventually we got used to what we call dissections. Dissections are about cutting. You cut. So you have this specimen, and then you cut the head, you cut the hands, you cut the legs to see really what the human body structure is made up of. Then there's what we call physiology. Physiology now tells us how the body functions. How does this heart pump blood? Because we all know, for you to be alive, your heart has been pumping blood right from the time that, even before you were born, actually at about 6 weeks, when a baby is still in their mother's womb, that is when their heart starts beating. So, and for them to remain alive, the heart has to continue doing that. So how does this heart pump blood? How does this brain work? How do these nerves, this electricity that allows us to do different things, work? That is what physiology is about. Functionality. We understood structure of the human body. We understood functionality of the human body. And then we also studied about different chemicals, because medicine involves using drugs, using vaccines. It is really a broad field. So we try and get a piece of what each of these different elements that interact with the human being are about. That is what was my experience in first year, and it went well. It went well. A few challenges here and there, but like I said, my eyes were fixated on my destination, and I knew this was part of the journey. One of the things that has helped me so much, one of the things that I keep telling myself is that it's actually a common quote, but it makes a lot of sense. I've talked of a destination, but it's important for someone to fall in love with the journey. It's important for someone to fall in love with the journey. If it is going to take 5 years, fine, it's important for you to have a picture of where you're going. But even the process itself is something that is important. Falling in love with the process was important for me. It was fascinating. It was like a journey of discovery for me. Discovery of what the science was about, but even self-discovery. So I look at medicine like a mirror that allows me to see myself, understand myself better, while I also understand other people better and the science at large. The other important thing is that medicine changed a lot of things, attitudes, and behavior that I had, because medicine, our profession, is a noble profession. So I had to cultivate that nobility in me, in the sense of improving how I look at time, because in our profession, time keeping is very important. You lose a few seconds, you could lose a life at the other end. So that had to be instilled in me. I'm not saying it came easily. Of course, it was a process. You would run late occasionally, but every time you would have to remind yourself that I need to do better here. The other thing that I had to learn was, dressing and smartness. So a lot of these other things, aside from the class knowledge, kept being sculptured into me throughout my journey. Coming to the second year of medical school, so we already had some momentum at that point in time. We already had a picture, and our university gave us the privilege to even start going to the hospitals, under supervision, not touching patients, but to see what the hospital environment looked like. And that helped so much because we were able to see where we're going and streamline our vision. So coming to my year 2 of medicine, now this is where we start to study about the abnormal science. Year 1 is so much about understanding the structure and how a normal person functions. But in year 2 now we start to study the abnormal science. If someone has malaria, what has gone wrong? If someone has typhoid, what is the problem? So that is what year 2 introduces us to. It also introduces us to drugs, because we use a lot of medicine in treating patients. So we learn these drugs. What is their structure? We learn about these drugs. How do we introduce them into the body? What are the advantages of swallowing the medicine over injecting the medicine via a vein? So we learn that in a subject called pharmacology. So we learn about the drugs. So ladies and gentlemen, it's important for you to understand that as doctors in our training, we strive, or as part of our regimen, we understand how drugs work. So when we prescribe medicine from an informed point of view. We know what this drug is going to do in your body. And so that's why it is not usually very wise for patients to self-medicate, because doctors assess and look at this broadly. So when the medicine reaches your body, where does it go? What does it do? So that is what we study also as part of year 2. Then we study also about microorganisms that cause disease. These you probably have heard of bacteria, germs, viruses. What should they look like? What is their structure? So, ladies and gentlemen, medicine is a whole umbrella. Aside from understanding, the person's structure, I need to understand the drugs. I need to understand the organisms that cause diseases. What are their properties? If you want to fight the enemy, you need to understand the enemy very well. So we do that as part of our training. And it is not just theoretical, it is very much practical. We do microscopy work. We're able to see these organisms because, we cannot see them with our naked eyes. So that is pretty much what we do in year 2. And for my institution, Uganda Christian University School of Medicine, we have more than just the scientific bit. We are taught ethics, especially Christian ethics. What are some of the things you consider when, you're faced with dilemmas? There are those points when you have to make decisions and the patient tells you, my religion doesn't allow this. What do you consider? And it's not just the Christian perspective, but we are taught how to consider other, what we call world views. So that was my experience in year 2, really, which unfortunately was interrupted by COVID-19 pandemic. So we had to withdraw from school, and there was a bit of remote learning at that point in time. But still, that in itself was a challenge that taught us something. So moving on to my year 3. Now year 3 of medical training is about, that's what we call the clinical years. In year 1 and year 2, someone has got what we call the basics and the abnormal, in quotes, the abnormal science. Now in year 3, the doctor or the doctor in training starts to now go to the hospital, and we call those ones junior clerks. Junior clerks are doctors in their 3rd year of training, and these ones now go to the hospitals. So in my year 3 of study, we start going to the hospital, Mengo Hospital. So what happens in the 3rd year of study? This is where the student in training is introduced to the hospital environment. After acquiring some knowledge in year 1 and year 2, we now want to introduce the student to the hospital environment. So that is what happens in year 3. And it came with its own challenges. A lot of us had to be taken out of our shells. We had to actually go out and learn to speak to patients. Some people were introverted, and they now had to actually start talking to patients, because that is a big part in medical practice. You have to talk, communication. So that was a challenge, and it was a big adjustment that we had to make, because you've been confined to the classrooms and the laboratories, and here you are expected now to go out and talk to the patients, ask them about their conditions, and that comes in with a lot of communication complexity. Someone who is in pain, someone who is having challenges, and then you want to speak to them, you want them to open up to you. So it takes a bit of skill and confidence for you to establish that connection with your patient. So that is a lot of what we're cultivating in our year 3. The other thing is year 3 for me opened up my eyes to the relevance of what was being taught in year 1 and year 2, because we had acquired quite some knowledge, and now we needed to see the applicability of what we had been studying. So, for example, they've taught us about malaria in class, but when someone has malaria, what complaints do they have? What when you touch them, when you listen to their breathing, what do you actually find? So that is what year 3 taught us. So it was in itself a challenge in terms of equipment, because you need a lot of equipment. You need blood pressure machines. You need what we call a stethoscope, the device that doctors use to listen to your chest. So that was a challenge in terms of financial input, and generally medical education is expensive, so that in itself was a challenge. Some of our colleagues were not usually able to start the semester on time, or they always had challenge with sitting exams, but it was part of the journey, because generally medical education is expensive in many parts of the world. So that was year 3. One of the disciplines, where there is actually 4 disciplines where you rotate. We call them rotations, because you're divided into groups, while some of your colleagues go to, for example, surgery. Surgery is that part of medicine that is about, it is, I don't know how I can define it, because it's really a broad sphere, but we are really repairing structure. We are repairing structure. For example, someone has a hernia, which is the organs, coming out of their space. The organs of the body are supposed to be contained within certain spaces. So sometimes when they protrude or when they come out of their spaces, that's what we call hernia. So part of what surgeons do is, to manually or surgically actually go and repair such structural defects. So that is part of what surgery is about, dealing with wounds. But it's actually broader than just that. Surgery is broad, and it's hard to define any one field of medicine with just a quick definition. So what I was saying is, you're divided into groups. While some of your colleagues do that surgery or they get surgical exposure, some people go to what we call pediatrics, which is child medicine, dealing with children, because children are unique. Children are not just small adults. They respond differently. They have different diseases that they usually suffer. So we consider this a special population that is studied separately. Then you can have another group doing what we call obstetrics and gynecology. And this is the branch of medicine that deals with women's issues, because women are a special population, and women both in the pregnant state and non-pregnant state. So that is the field of obstetrics and gynecology. And then we have what we call internal medicine, that is adult medicine. So you now get exposure, you rotate, you move through those different fields or subdivisions of medicine in our third year, getting exposure, learning to speak to patients, but also appreciating the practicability of what you've been taught. That is what happens in third year. So we had to learn communication. It was a process. I don't want to say it was something that we learned instantaneously. It was a journey, and we got better with time. We also learned how to examine patients, how to touch patients, because when you go to see a doctor, after having the interview with them, after having the discussion and telling them about your symptoms, the doctor has to, touch you, to listen to your chest. That's what we call examination, examining the patient. So you learn the skills as a doctor of examining a patient. So it is not something you do anyhow. We have certain things that we look out for. So we learn that in school, and over time, we perfect that skill. So that is precisely what year 3 is about. And at the end of that, you have exams, We do both practical exams and theoretical exams. And our seniors assess our ability to establish a connection with the patient, because having that connection with the doctor is important in healthcare, for you to be able to open up to this doctor, tell them some of those private things, that you probably would not share with anyone else. So that was year 3, and that was my experience with year 3. Moving on to year 4. So in year 4, if you're out there and you are someone who wants to do medicine, in the 4th year of medicine, what we do is we go through what we call specialties. So medicine has many branches. Medicine is broad. Like I already mentioned, it can be surgical, it can be children medicine, it can be geriatrics medicine, working with old people, and all these are unique fields. So in year 4, you go to the different specialties. Now, for example, surgery alone has other different small sections. We have surgeons that deal with the head or the brain, what we call neurosurgeons. We have surgeons that deal with the chest conditions, and the heart, cardiothoracic surgeons. We have what we call general surgeons that deal with general conditions and intestinal problems. So medicine is very broad. Then we have radiologists. These deal with imaging, x-rays. Sometimes you go to the hospital and the doctor says, let us do an x-ray. So radiologists do deal with that. How do we interpret findings on an x-ray to know what condition this patient is suffering from? So that is all part of medicine. So year 4 gives you exposure to those different subspecialties of medicine. So some of the challenges we had in year 4 is that, of course, tuition challenges are always there. That was still a problem for many of us. And then the other issue was the bulk of work, because medicine is 5 years, but they say medicine is like drinking an ocean, or it is like eating an elephant. Meaning, medicine can be understood. When you study, you can understand, but it is very wide. And as an undergraduate doctor, someone doing their degree, you're expected to actually learn everything. It's at masters that you can now specialize and say, I want to concentrate on pediatrics or child medicine. But as a general doctor in training, as an undergraduate, you're expected to have knowledge that spans all these fields of medicine. So the volume of work was a lot. We are expected to know so much in such a very short time, and that is a challenge in itself. Sometimes you study this and then you forget it. So I like to think of medicine as a journey. It is a destination, and it's important to know where you're going, but it's important to also know that it's a journey. You get there one step at a time. So we had to improve our studying habits. We had to maximize retention of information, because you have to remember the information. When you're going to treat a patient, there's a lot that you have to remember, so that you manage them from an informed point of view. So for me, I had to work on my study habits. I had to appreciate the fact that I had to continue studying consistently. Consistency is important. It was a challenge, but sometimes you find yourself running late, and there's an exam and you've not covered everything. There's a bit of nights where you have to keep awake in order for you to cover the large volumes of work. You have to discuss. So those were all challenges in medicine that we had to learn to live with. Now, moving on to the final year of medical school, which is year 5, because you take 5 years to be called doctor. And the 6th year of internship is really about now working under supervision. So interns are not exactly students. Interns are doctors, just that they are working under supervision from senior colleagues. So in year 5 is what we call senior clerkship. So here you're expected now to take it a notch higher. At this point in time, you have the knowledge of the basics. You've learned how to talk to patient. You've learned how to examine the patients. So in year 5, this is really like wrapping everything up. And still you go back to the major specialties or the major 4 subdivisions, that is surgery, pediatrics, gynecology and obstetrics, and then internal medicine. So that is what we do in year 5. Now here you go ahead to not just interview the patient, not just examine, but you're supposed to be able to do investigations. You're supposed to be able to diagnose. If someone says, I have cough, what might be causing that cough? What tests can I do to find out what might be causing them to cough? Is it asthma? Might they be having tuberculosis, TB? Might this person be having a foreign body? Might this person be having a pneumonia? So we learn to now be able to investigate and distinguish the possible cause of this patient's symptoms. Then we also learn how to manage. After understanding or after diagnosing a pneumonia in a patient, what medicine are you going to give? And what medicine are you not going to give? What dose are you going to give? How often are you going to give this dose? What are the side effects and how do you manage them? And, you know, in medicine, one of the things that we are taught is that every patient is unique as an individual. Much as the condition might be the same, every patient is supposed to be looked at uniquely. So that's the other thing that medical school taught me. And in that individuality of patient care or individualization of patient care, I learned to appreciate diversity of people. You know, people are different. Every patient that comes to you is unique. So it helps me appreciate, you know, humanity and learn to respect diversity of people on grounds of religion, on grounds of geographical location, on grounds of race. Every person is unique and should be looked at uniquely. So that's the other thing that medicine has taught me. The other thing that year 5 taught me is learning how to teach and communicate. The word doctor actually comes from a Latin word, docere, which means to teach. So as a doctor, you are a teacher. Who are you teaching? You're teaching your patients. Let them learn about their condition. As a doctor, you're teaching your junior colleagues. So as a 5th year student, you teach the 3rd years while you also learn from them. So it is two-way. Every person has something to offer. Then even yourself, you're teaching yourself as you study. So medicine is a lot about teaching. When you can teach, when you can acquire knowledge and give back that knowledge, then you're really living up to the mantle of being a doctor. So that is pretty much of the journey that we go through in those 5 years. I really had to summarize it, but it's actually a lot that happens here and there. And for me, it molded me. Like I said at the start, it has been a mirror for me. I've learned to, you know, think about, you know, myself, to do introspection. I've learned to, you know, appreciate other people and have them be heard, because as a doctor, you have to be a good listener. So it has helped me even in my life outside medical school, outside the hospital, learning to listen to people and give them time to explain themselves, learning to empathize with people and understand, you know. So all that has come in handy through my journey of medical school. Being a doctor in Uganda, there's a number of challenges. In any setting, there's challenges. There's a lot that is going on. There's a lot about budgetary implications. And part of what we were taught that I didn't mention is something called health service management. That's a course unit where we learn about the health sector and the leadership of the health sector. We are taught that in Uganda Christian University Medical School. That's why I'm really thankful, because we have a whole regimen, not just medicine. So people tend to think of doctors as, you know, bookworms, as people that are, you know, just localized, that are very limited in how much knowledge they have. I want to say, no, that is not true. Doctors actually learn to, you know, think all round through different spheres of life. So in health service management, we are taught how the health sector is run, both locally, that is Uganda, regionally at the level of Africa, and even globally, organizations like World Health Organization and the public health aspects. So as doctors, we are not just confined to the hospital, but doctors, we are not limited. That is the other thing that I've appreciated about medicine. That's one of the things that I didn't expect that I actually found. You know, doctors are not limited. Medicine has allowed me to break out of my box of just thinking hospital-wise, but thinking globally. Looking back at events like COVID, the pandemic, and how it affected not just the health sector, but even the economic sector, even religious sector was affected because people could not gather. So, ladies and gentlemen, my exposure has taught me that medicine is vast, that medicine is core, because we cannot be productive when we are not healthy. We cannot be happy when we are not healthy. So that is the other thing that we learned. The other thing that I've learned in medicine is what we call research. Still in our journey of 5 years, we are taught about research because, diseases change. Organisms that cause disease are changing. So medicine is not a static profession. It's not a static sphere. It is dynamic. It keeps changing. Diseases change. They tell you malaria organisms are now becoming a bit more resistant. Bacteria are becoming resistant to these drugs. So as doctors, we need to keep thinking. We need to keep experimenting to come up with better modalities of healthcare. So that is what research is about. And we are introduced to that also. What do you do in research? How do you structure research? So, ladies and gentlemen, if you're out there and you've been considering doing medicine and surgery, it is actually a two-in-one, medicine and surgery. So that is the course of what we go through in the 5 years. And those are some of the challenges. I've not exhausted everything. And like we said, medicine is noble in the sense that one of the things it has given me, even at this point early on, is that there is that satisfaction that it has given me, in the sense that, being able to give people good health. A patient comes in sometimes into the hospital and this person is not breathing well, or their heart has stopped beating, but being able to help this person, to see them come back to life, is in itself a milestone for me that I experience every day when I'm in the hospital, seeing people get better. Of course, some stories don't end well, but it's a continued struggle. It's a continued process. It's a journey, like I said. Every day we learn. Every day we improve through research, through acquiring knowledge, through interacting with colleagues, through learning from our seniors, through interacting with our patients, because you, the patients, teach the doctors. So that is it. And for parents that want to sponsor their children for medicine and surgery, it's costly and it is demanding emotionally. It's very engaging for the students themselves. We don't have very long holidays. In a year, we have 3 semesters. The first semester, a second, and then we have what we call a recess semester that is shorter. So sometimes you find yourself having holiday for just 2 weeks, holiday for 1 week. So it happens. But what I've learned from that is that it keeps you on your toes. Medicine is likened to being in the military, where the call of life can come anytime, and you have to be able to heed. When you're called upon to come and save life, you have to be able to respond. You have to be able to respond to that duty that you have to the patient. So those are some of the challenges. Then to our patients out there, I just want to reassure you from my story and my experience that the time that a doctor spends in training gives them wide exposure. So we need to learn to confide in doctors. We need to learn to trust our doctors, to establish, partnerships with doctors. And then to the doctors, let's continue teaching our patients. Let's continue helping them understand. Remember, medicine is teaching. We teach our patients. So, ladies and gentlemen, that is a bit of my experience with medicine. And I hope that you can learn something from it. Thank you so much. And thank you so much, Tony, Dr. Tony Kakumba, for this interview, for this opportunity to share what I think about this. And maybe a last one. I'm writing a book where I put all my experience together, and I'll be happy if you share, or if you get a copy and share. in my knowledge. Thank you.